Hello and welcome. Today we're delving into the urinary system to understand a condition called ureterocele. We'll explore what it is, why it happens, how it affects the body, and what can be done about it. So, let's embark on this journey to unravel the complexities of ureterocele. Ureterocele, at its core, is a birth defect. It arises during fetal development when the ureter, the tube that carries urine from the kidney to the bladder, doesn't fully develop correctly. Instead of seamlessly connecting to the bladder wall, the end of the ureter balloons out, forming a sac-like structure. While the exact cause of this malformation remains largely unknown, it's believed that a combination of genetic and environmental factors may play a role during this crucial stage of development. In some cases, ureteroceles are associated with duplicated collecting systems, meaning the kidney has two ureters instead of one. The fundamental problem in ureterocele lies in the obstruction it creates. The balloon portion of the ureter protrudes into the bladder, obstructing the flow of urine. This obstruction can occur at the opening of the ureter itself, or it can compress the opening of the bladder, or even the other ureter. The consequences of this obstruction are far-reaching. Urine backs up into the ureter and potentially into the kidney, a condition called hydroter and hydronephrosis, respectively. This backflow can lead to increased pressure within the kidney, potentially damaging the delicate filtering units called nephrons. Furthermore, the stagnant urine becomes a breeding ground for bacteria, significantly increasing the risk of urinary tract infections. Ureteroceles are relatively uncommon. They are estimated to occur in approximately 1 in every 4,000 births. Interestingly, they are more frequently observed in females than in males. They are also more commonly found in Caucasians compared to other ethnic groups. While ureteroceles can occur on either side of the body, they are more frequently located on the left side. While rare, ureteroceles can also be bilateral, affecting both ureters. It's important to remember that these are just general trends, and ureteroceles can occur in anyone, regardless of gender, ethnicity, or family history. The signs and symptoms of ureterocele can vary widely depending on the severity of the obstruction and the age of the individual. In some cases, particularly those detected prenatally, there may be no obvious symptoms at birth. However, as the child grows, or in cases with significant obstruction, symptoms may emerge. These can include recurrent urinary tract infections, which often present with fever, abdominal pain, and painful urination. Hematuria, or blood in the urine, can also be a sign. In severe cases, the obstruction can lead to kidney damage and even kidney failure, presenting with symptoms like high blood pressure, swelling, and fatigue. In infants, a bulging mass may be palpable in the lower abdomen. It's important to consult a doctor if you observe any of these symptoms, especially recurrent UTIs or blood in the urine. Diagnosing a ureterocele typically involves a combination of imaging techniques. Prenatal ultrasounds can often detect ureteroceles before birth. Postnatally, an abdominal ultrasound can provide detailed images of the kidneys, ureters, and bladder. Avoiding cystoarthrogram, or VCUG, is another useful test. This involves inserting a catheter into the bladder and filling it with a contrast dye. X-rays are then taken while the child urinates, allowing doctors to visualize the bladder and ureters and identify any abnormalities like ureteroceles. A diuretic renal scan, also called a MAGE-3 scan, can assess kidney function and identify any obstruction to urine flow. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, can provide a direct view of the ureterocele and surrounding structures. The choice of diagnostic tests will depend on the individual's age, symptoms, and the clinical suspicion. Ureteroceles are often classified based on their location and relationship to the bladder and the ureteral orifice. An orthotopic ureterocele is one that is located within the bladder and does not extend into the urethra. These are typically smaller and less likely to cause severe obstruction. An ectopic ureterocele, on the other hand, extends beyond the bladder neck and into the urethra. These are more commonly associated with duplicated collecting systems and are more likely to cause significant obstruction and other complications. The size and degree of obstruction also play a role in classification, with some ureteroceles being minimally obstructive while others can severely impede urine flow. The classification of ureterocele helps guide treatment decisions and predict the potential for long-term complications. The treatment of ureterocele depends on several factors, including the patient's age, the size and location of the ureterocele, the degree of obstruction, and the presence of any associated kidney damage. In some cases, particularly with small, asymptomatic ureteroceles, observation may be the only necessary treatment. Regular monitoring with ultrasounds and urine tests is crucial to ensure that the ureterocele is not causing any problems. For larger, symptomatic ureteroceles, surgical intervention is typically required. Endoscopic incision is a minimally invasive procedure where a small incision is made in the ureterocele using a cystoscope. This allows urine to drain more freely. Ureteral reimplantation is a more complex surgery that involves removing the ureterocele and reattaching the ureter to the bladder in a new location. In cases with severe kidney damage, a nephrectomy, or removal of the affected kidney, may be necessary. The overall goal of treatment is to relieve the obstruction, prevent urinary tract infections, and preserve kidney function. Antibiotics may also be prescribed to treat or prevent infections. Close follow-up with a pediatric urologist is essential to monitor the long-term outcome. Unfortunately, because ureterocele is primarily a birth defect, there are no definitive ways to prevent it. Prenatal care, including regular check-ups and ultrasounds, is important for early detection. Genetic counseling may be considered if there is a family history of urinary tract abnormalities, although the role of genetics in ureterocele is not fully understood. The prognosis for individuals with ureterocele is generally good, especially with early diagnosis and appropriate treatment. Many children with ureteroceles can lead normal, healthy lives. However, long-term follow-up is essential to monitor kidney function and prevent complications. Potential complications include recurrent urinary tract infections, kidney damage, high blood pressure, and rarely, kidney failure. Recent research is focusing on improving minimally invasive surgical techniques and developing better imaging modalities for early detection. Researchers are also investigating the genetic and environmental factors that may contribute to the development of ureteroceles. Advances in prenatal imaging techniques are allowing for earlier detection and more precise planning for postnatal management. The ongoing research is promising and will hopefully lead to even better outcomes for children with ureterocele.